Members of the Fourth Estate, my fellow Kenyans, a good afternoon to you. Let me start by wishing our brothers and sisters, Muslim brothers and sisters in the country, a happy Eid Mubarak as they mark the end of the holy month of Ramadan. We all join you in celebration, and I want to assure you that the whole country wishes you well. As we celebrate the end of Ramadan, we are aware that this year's celebration has been a little different from the previous ones. The pomp and religious activities that have always been part of the culture and tradition in observing Ramadan has been restricted. Today's celebrations are devoid of fanfare, fellowship, and ceremonial visits characteristic of Eid al-Fitr. But this is not unique to us here in Kenya. Similar scenario is being observed in most parts of the world, and understandably so. Who would have thought that the two holy mosques in Mecca and Medina would also be closed during this period? But they have been closed. The presence of coronavirus has necessitated a rollout of interventions and responses to combat it. Some of these responses have indeed been inconveniencing and even disrupting aspects of human interaction. As a country, our response included cessation of movement in and out of the counties of Nairobi, Mombasa, Kwale, Kilifi, and Mandera. Additional measures included restriction of movement in and out of the localities of Eastleigh in Nairobi and Old Town in Mombasa. We understand that these measures have made life uncomfortable for our people. I want to state that the restrictions are not punitive and are not directed at any particular community. The restrictions and measures have been advocated for in the interest of public good and to contain the spread of the infection. Other countries that have effectively managed to contain the virus have imposed the same and perhaps even tougher ones. I think most of you are aware that in many of the countries, especially starting with China in the beginning and later on in the European countries, they imposed a total lockdown in certain provinces in China, but in countries such as Italy and others, it was a total lockdown, national lockdown. That is almost a 24-hour curfew kind of an arrangement. We have not reached there. And we don't want to reach there. We want to put measures in phases so that we do not unduly complicate life for Kenyans. But these measures are necessary, and they may come in phases, and they may target certain areas. It was Eastleigh and Old Town. It is very likely, as I had said earlier before, that as our data improves, we have a better understanding of the level of transmission within the community, we will target those areas that we consider a high risk and impose further measures on those areas as well. I want to thank the residents of Eastleigh, Old Town, and the rest of the country for being calm and understanding during the entire month of Ramadan. It is certain that the successes that we have achieved are owed to their cooperation. I therefore want to appeal to all of us to continue obeying and complying with the restrictions and advisories issued by the Ministry of Health as we soldier on to combat this pandemic. Fellow Kenyans, as we celebrate with our Muslim brothers and sisters, I want us to remember that our fight against COVID-19 is not yet over. As the government, we are aware what these measures have caused in terms of inconvenience and complication of the lives of Kenyans, including limiting religious activities and gatherings. I can assure you, just as His Excellency President Uhuru Kenyatta said yesterday, the partial lockdown measures would not go on longer than necessary and will be reviewed if Kenyans follow the containment measures that will reduce the number of infections and flatten our curve. I am glad to note that many Kenyans are complying with the containment measures of hand washing, social and physical distancing, sanitization, self-quarantine, and even wearing of masks. I want to urge all of us to continue with this practice because it is the most effective way of combating this pandemic. I also want to appeal to the few who are not towing the line in this journey to quickly change their minds for the benefit of their loved ones and the country at large. Because a chain is only as strong as its weakest link. Let us not be that weakest link in this chain. I want to reiterate on the importance of targeted testing. This activity, which is currently going on in Nairobi and Mombasa, is aimed at identifying those of us who may be having the virus in order to have them treated and also protect others from being infected. If we do not know where the virus is, it will be very difficult to fight it. We have said that this is an enemy that is unseen and that can appear anywhere, and we need to be prepared for it. If the targeted testing is precisely aimed at achieving this, for those who will be positive, together with their contacts, I want to remind and reassure the people of Kenya that the government shall meet the cost of treatment and quarantine. We are aware that this has been a source of concern for most people and a concern that has led to weakening the fight against containing the virus. Because when people feel that they will be quarantined at their cost, they do not then cooperate and present themselves and their contacts for containment of the virus. So once more, there is no financial concern that those who turn out positive and require treatment and their contacts who will require quarantine have to fear about, because these costs will be met by the government. Our people should therefore not be afraid to come out for testing. And I also want to commend those that have presented themselves, and we have seen that more and more Kenyans are now coming out on their own to present themselves for testing. The more we do this, the more we understand the level of transmission of this virus within our communities, and the better equipped we are in targeting our interventions in those areas of highest risk. On targeted testing, we have noticed at the same time a disturbing trend of individuals who provide wrong contacts and telephone numbers during testing. Once the results are out, such individuals then become unavailable. This is serious, considering that some of them have tested positive and need to be contained together with their contacts. If we are unable to trace them, then we have weakened our effort at containment. I want to appeal to all our people to be responsible and provide accurate contact details during testing. The consequence of not doing so, particularly when one tests positive, can be disastrous. And I want to tell such people too that by acting in this manner, you are also exposing your loved ones to risk, because surely you will be transmitting the disease with those that you interact very closely with, who would be your loved ones and your family. We appeal again to this group of people who do not provide the right information to please do so that the necessary treatments and interventions can be provided. Turning now to our COVID-19 situation and the statistics so far, I want to report that over the last 24 hours we have tested a total of 1,108 samples. Of these, 22 have turned positive for COVID-19, which brings the total number of confirmed cases in the country to 1,214. The cumulative numbers of tests that we have done so far stand at 59,260. In terms of gender, we continue to see the pattern skewed towards males, with 17 of these 22 being males and 5 being females. The age group of the cases over the last 24 hours is between 24 years for the youngest and 73 years for the oldest. In terms of their distribution of these cases in the counties, Nairobi County reported 10 cases, Mombasa 9 cases, Kwale 1 case, Nakuru 1, and Taita Taveta 1 case. If we look at Nairobi, the breakdown of the cases by sub-county is as follows: Mathare 2 cases, Kibera 2 cases, Makadara, Embakasi West, Eastleigh, Ruaraka, Langata, and Westlands each had 1 case. For Mombasa, the 9 cases are from Mvita with 5, Changamwe with 1, Jomvu with 1, Likoni with 1, and Nyali with 1. Kwale County had 1 case from Lunga Lunga. Nakuru County, 1 case from Nakuru West. Taita Taveta, 1 case from a quarantine facility in Taveta. We are glad to inform you today that we have discharged another 3 patients who have recovered from the disease, bringing the total number of recoveries to 303. Again, we take this opportunity to thank our healthcare workers and hospital staff for providing the necessary and compassionate healthcare and collaboration to keep our patients safe. We also, of course, from time to time expect that some of the cases will turn out to be fatalities. On a sad note, I report that we have lost 1 male patient aged 48 years old from Mathare, and this brings our total fatalities to 51. Our hearts go out to the family and friends during this time of grief. Accept our sincere condolences. As I conclude, I take this opportunity to also share with you and congratulate our Acting Director General, Dr. Patrick Amoth, who this past week was elected Vice President of the World Health Organization Executive Board. This is quite a prestigious appointment and a major accomplishment to one of our own, and it shows the confidence with which we are being recognized internationally and in the global arena. Finally, I once again want to wish our Muslim brothers and sisters a happy Eid Mubarak. I thank you.
Thank you, sir. We can ask questions.
Oh goodness, they can come forward so we can hear, because we're having difficulty sometimes hearing the questions.
My name is Nancy Opare from KBC, and it's been about 2 weeks since the people who are stranded, the Kenyans who are stranded in India, jetted back into the country. So they were placed in quarantine. I would like to know if you're still monitoring them, how many have tested positive so far, and also we'd like to know about the quarantine facilities in the country, and especially the numbers, given that in the recent days we've only been receiving maybe one case of a positive case being recorded from the quarantine facilities. Does it mean that the numbers there are lower, or those being tested there are turning out negative?
My name is Chemtai Goin from Citizen TV, and you have intensified testing in the border points to ensure that even truckers, if they need to move goods and services, are safe. So far, there have been protests in some parts of the border points, truckers saying it's taking too long to get their results. And a few days ago, there was the launch of the mobile labs. Have they been taken to those border points, or what is the plan to ensure that the process is faster?
My name is Eunice Omolo from NTV. I have two questions. The first one is in regards to the testing of the truck drivers.
I can't hear. Louder, please.
The first one is in regards to the testing of the truck drivers. Kindly, if you can explain to us if they have a holding facility where they can wait for the results. And then number two, we wanted to find out how many sectors so far have submitted their recommendations in line with the COVID-19.
How many sectors?
How many sectors have submitted their recommendation in terms of the changes or the possibility of lifting of the restrictions that have been put in affecting all these sectors? Thank you.
Okay, thank you very much. Let me start with the question by Okwaro, KBC. Your question was specifically regarding the Kenyans who came from India about 2 weeks ago, and you would like to know what their state is in quarantine and whether they have tested positive, some of them, and the numbers. I can tell you that if you remember, those cases that came from India were largely Kenyans who had sought treatment in India and who were recovering together with their caretakers, were the ones who came in largely. So, and as equally as these returnees from abroad are coming back to the country, there is also a requirement that they must already have been tested from their point of departure before they come in. So they were already, most of them were negative, because nobody who would be positive would be on that airplane to come in. But because of precaution and necessary guidelines according to the World Health Organization, anybody who comes in is placed in quarantine for a period of 14 days. I do not know whether that timeline has lapsed, but I will ask Dr. Kuria to expound on that and give you as an idea of whether the period has lapsed and how many of them have turned out positive and have been tested thus far. Dr. Kuria will respond to those statistics. Chemtai, Citizen, your concern is about the turnaround time of testing for truckers at the border points, and you wanted to know about the mobile lab that was launched the other day. I can tell you that this continues to be an area that the government is paying a great deal of attention to be able to streamline this, because it affects our relationship with our neighbors and it affects the trade, the free movement of trade between these boundaries. And it's a matter that is being discussed at very high level, at the presidential level between presidents, as well as at other levels, in order to try to work out a solution to this. I can tell you that in the Namanga border, we have already mobilized, and as I speak, the mobile lab is already in Namanga and is being set up. So we hope that with that mobile lab we will be able to, we certainly know that we will be able to shorten the turnaround time so that we do not hold truckers there for too long, that we can release them once they turn positive. We have also entered into a protocol agreement with our Tanzanian counterparts that we ensure all these truckers that are crossing the border on either side will come with a COVID-19 free certificate from their point of origin, that they will take the necessary test agreed upon at the point of origin 48 hours before departure of their journey, so that when they arrive at the border, they will be able to be passed through without any problem if they are carrying the COVID-19 free certificate. All these measures are intended to improve the level of trade and movement of goods, while at the same time protecting the countries from entry of coronavirus that may come in through these movements across the border. Then there was a question regarding truck drivers and whether we do have a holding facility for them. I would say yes, and Dr. Kuria will expound on that. We are looking at if we are testing people at the borders who do not hold that COVID-free 19 certificate, we will continue to subject them to our tests at the border. At that point, then, if they are from the Kenyan side, we will have a facility to be able to hold them so that they do not mingle with others, and to reduce the chances of transmission of the disease in case some of them are positive. I think those are thoughts that we have looked at, and we have a plan, and yes, I think there is a holding facility. In terms of whether other sectors, I think you're talking about other sectors, maybe the trade sector and so on, what the plans are. You know that this response is a one government response. All of these sectors converge at the high level of the National Emergency Response Committee that looks at all of these issues, that then discusses across all sectors what some of these measures would mean, and then decisions are made at that level. So every sector is represented in making these decisions when the measures are either imposed or made stricter, or when they are eased or lifted. And I think it will continue to be so in that way as we follow a one government approach in this pandemic response. Let me ask Dr. Kuria now to respond to those one or two questions in terms of the numbers and other details. Dr. Kuria.
Thank you, Kas Rashid. I'll start with the question on those who jetted in from India. And as Kas Rashid has rightly put it, most of those who jetted in had COVID-19 certificates. And I can confirm here that most of them were coming from treatment centers in India. And as such, most may have been allowed to go under self-quarantine under the care of doctors who submitted letters of obligation to take care of those patients that we allowed to go on self-quarantine. We were left with only about 59 who went into mandatory quarantine in various facilities. This have done the 11th day, and indeed, yes, testing was done on most of them. We also had those that arrived from China and London, and when each hits their 10th day of quarantine, we are in contact with the Nairobi Metropolitan Service, who are coordinating the testing for all those in quarantine. And we can confirm that even those who went on self-quarantine, yesterday were assembled at Gara Health Center, less for about 14 who are not reached, and they were all tested yesterday, and their results have been released today. And yes, there are some positives arising from those who are in quarantine, and these are being isolated into the various isolation centers within Nairobi. On the issue of the holding area for truck drivers, yes, as Rashid has rightly put it, we are trying to avoid the issue of holding areas for truck drivers. As we issued our guidelines last about 2 weeks ago, we pointed out the need to have a COVID-free certificate before you embark on your journey. As I said, yes, and as rightly put it, there are those few good drivers who obey and are presenting themselves with certificates. But there are those who still choose not to appear at the border point with their certificates. We are proceeding and testing them, and for this then we are working with the county commissioners to have them held in a certain area away from the border point where they are not allowed to mingle with the community. So we're working closely with the county commissioners to make sure that these holding areas are well manned so that this mingling is reduced. But this we ought to avoid if all drivers could comply and follow the guidelines that we issued, so that you do not embark on your journey until you have your COVID negative certificate. There will be no need to hold you at the border, unless during surveillance we notice that you have symptoms akin to having developed COVID in the course of your journey. Only then do we test you. And even then, in certain border points like Namanga, having deployed a mobile laboratory by Monday, we intend to cut down the waiting time to about 6 hours. So again, no need for holding area, 6 hours of waiting, no mingling, then we allow you to proceed. So as we walk around the issue of holding area, we still urge drivers, do not start your journey if you do not have your COVID negative certificate. Let us act responsibly. I think that is all that I had to respond to.
Yeah. Okay. Thank you. Thank you.
Thank you so much, sir. Those are the questions we want, meeting like this one, so please pray for tomorrow. Thank you so much.